Hi everyone, my name is Borde. I'm an author and the mom of 3 autistic children. Today we'll be talking about the most controversial form of therapy for autistics, known as ABA. But before we do that, please take a minute and subscribe to this channel for more autism related videos. Applied behavioral analysis is the most common and intensive form of therapy intervention used for individuals with autism. However, it is not used exclusively for autistics. This method is also used for individuals with dementia, eating disorders, anger-related issues, OCD, and others. The practice core belief in a nutshell is that appropriate and desired behaviors can be taught through a system of reward and consequences. It is believed to help improve social and verbal skills and significantly decrease behavioral issues such as aggression and self-harming. ABA is considered a controversial practice since who can really define what is appropriate behavior? Does desired behaviors means ABA is actually looking to make autistics repress their uniqueness and attempt to make them pass as neurotypicals? Are they trying to cure autistics and by default traumatizing them in the process? Or is ABA simply a method of trying to help autistic children adapt easily to new environments and prepare them for the future ahead? According to a 2011 study called Behavioral Intervention in Children and Adolescents with Autism Spectrum Disorder, a review of recent findings, ABA for young children is an effective form of therapy to improve language and cognitive skills, social behavior, and reducing anxiety and aggression. There are many studies such as this one, many of them supported and funded by Autism Speaks, the largest and most controversial autism-related organization in the world. There are many other studies and research not funded by Autism Speaks that also finds the ABA treatment to be effective. Can ABA cure autism? The short answer is no, because autism is not a disease or an illness that you need to seek a cure for. But Dr. Ivar Lovaas, known as the father of ABA, feels the same about autism. He stated the following: you see, you start pretty much from scratch when you work with an autistic child. You have a person in the physical sense. They have hair, a nose, and a mouth, but they are not people in the psychological sense. One way to look at the job of helping autistic kids is to see it as a matter of constructing a person. You have the raw materials, but you have to build a person. For Dr. Lovaas, autistic individuals only fall in the category of humans in the physical sense, not in the psychological sense. And it was the job of his method, the applied behavioral analysis, to build a human that possesses certain characteristics who could become indistinguishable from their peers. His methods were focused mainly in punishment, such as slapping, yelling, and demeaning if there was no compliance on the part of the child, and even the use of, hear what? Electric shock if necessary. Oftentimes, ABA therapists state that these methods are nowadays considered unethical and that the practice has evolved throughout the years and it's no longer punitive. Although some people argue that up to 40 hours a week of constant drill for compliance and normalcy in a young child's life is not punitive only but also dangerous. Many parents believe that ABA works wonderfully for their children and they have no regrets. However, how affected are some children and adults who went through ABA? A study published in 2018 in the journal Advances in Autism found that almost half of children and adults who went through ABA met the criteria for post-traumatic stress disorder. And extreme levels of severity were also recorded in 47% of the affected subgroup. The subjects were also 86% more likely to experience it than their unexposed peers. According to the study, children meet the PTSD criteria just 4 weeks after starting ABA intervention. All parents want their children to succeed in life and become independent one day. In the case of autistic children, we all want to provide the right support and interventions that might be needed so our children can be happy autistic adults and not adults trying to pass as neurotypical who think that in order to be loved and accepted in society or in their own families, they must hide their stimming, forced to make eye contact, hug, or talk where they don't feel to. Autistics are not marionettes. Autistic adults in most autistic-led organizations do not support it and call it torture and traumatizing, with a lot of them dealing with the pain and trauma up to this day. It is important to listen their stories since ABA affects them directly. And as parents, we could also use their experiences to make informed decisions. Even though it is most likely that they will have different perspectives, when we see a certain pattern in those answers and experiences, we need to pay close attention. As parents, I think it is imperative to remember that our autistic child is not someone who needs to be fixed or repaired like you fix a clock or a table. So when looking for the right therapy for your child, ask yourself, will this intervention help my child improve their quality of life? Opposite to, will this intervention help my child act or sound normal so nobody can detect that he or she is autistic? I hope you enjoyed today's video and it can help you decide the correct form of therapy that your autistic child might need. Please don't forget to subscribe to my channel for more autism related content. Thanks for watching.